Recording, engaging, and I'll be on scale.
Yeah.
Right. Yeah.
But I know.
Yeah, I can. Yeah. Yeah.
It's free from contamination.
Yeah. You're quite.
And it's on premises, very good.
Thank you. Questions about it?
Thanks for joining today. I would like to welcome you to our side event, Unpacking Safely Managed Drinking Water Services. This is a joint event organized by the Joint Monitoring Program. We've got Rick Johnston here, who will be our first presenter today, and also by Joe Podgorski from EAVAC, and we're both from the Swiss Federal Institute of Aquatic Science and Technology. And so today we're going to be talking about progress on collecting data on safely managed drinking water. Rick's going to give us the first updates from the 2021 report, and then we're going to go into how we can fill data gaps with which exist with different alternative approaches, focusing on machine learning modeling using Earth observation data. So I welcome Rick to come up. Rick is here from the Joint Monitoring Program. He leads the WHO side of it, and he obtained his PhD here at some point from from North Carolina, Chapel Hill. So please, Rick.
Thank you, Esther. Yeah, I did get my PhD here. Actually, I did my lab work here in 2004, and then I got a job with UNICEF, and it took me 4 years to write up the PhD. So I really don't recommend working full time while writing up your PhD. So try to avoid that extent. And I also work at AOBOG, where Esther is now. So another great organization. So it's great to be back here. We're going to talk today about safely managed drinking water services, one of the SDG indicators that the WHO UNICEF Joint Monitoring Program tracks. And I want to really unpack both the definition of that indicator and the data sources and how we combine data from different sources. And then we're going to have 2 inputs from the team at AOBOG about these machine learning approaches to filling data gaps. So the theme is definitely data gaps. So I thought I would start by just orienting people on the latest JMP report on washing households, which came out a year ago now. And all of our reports, all of our database rely on national sources of data. So it's not that the JMP goes out and collects data. We go out and collect reports of data that other people have collected. And you can see that we have a lot more data sources, about 3,300 each for drinking water and sanitation. We have about 6,000 plus data sources in our database. Some of them don't get used. So around 4,500 or so were used to produce the estimates that go into the report. I call them estimates because they draw on multiple sources of data, and we put them into a very simple linear regression model, no machine learning, no artificial intelligence, just a simple linear regression model to produce estimates for all years. Hygiene and menstrual health, you can see have far fewer data sources. Those ones come only from household surveys. But if we look at drinking water and sanitation, there's almost an even split between censuses on the bottom and household surveys, and then maybe a smaller number, but a significant number of data coming from administrative sources. And those might be a sector report or the report of a statistical office or a regulator, say about the quality of services. So the definition of indicator 6.1.1, which is used to track SDG target 6.1 on drinking water, is safely managed drinking water services. So the population using safely managed drinking water services is defined as the population that drinks water from 1, an improved source, 2, that it's accessible on premises, 3, it's available when needed, and 4 is free from fecal and priority chemical contamination. So this is a composite indicator. It's got a lot built into it. It's got at least 4, probably more, sub-indicators that go into defining that highest level of the SDG ladder, the water services ladder. And then we have basic services, limited, unimproved, and surface water. But the thing about the safely managed is you need to have all 3 of those elements. It's an intersection. You start with having basic services, which is use of an improved water source that doesn't take more than 30 minutes. And then if it's also free from contamination, accessible on premises, and available when needed, counts as a safely managed service. Doesn't have to be piped water, by the way. Some people think you have to have piped water to get safely managed. Not the case. You can have a private well that's located on premises, gives you water when you need it, and is free from contamination. Perfectly fine. So what our 2021 report found was that the world is quite far off track to meet the SDG target of universal access for all by 2030. You can see the different SDG regions. If you look at the least developed countries, for instance, you see safely managed drinking water only went from 33% to 37% over the 5 years from 2015 to 2020. So progress, but nothing like the scale of progress you would need to reach 100% by 2030. Even at the global scale, where the picture's a bit better, going from 70% to 74%, you know, this is about 1 percentage point per year, which obviously is not going to get you to 100%. In fact, we predicted that if current rates of progress continued, and this was all, you know, pre-COVID, so who knows what that means. But if historical rates continued, the world would only reach 81% safely managed services by 2030. Wouldn't even reach universal basic, that's in the light blue, by 2030. And to get to 100%, progress in basic wash would need to double, and progress in safely managed services would need to quadruple. So big challenges ahead there. So I want to zoom in now to this bit about fecal and priority chemical contamination, because that also has multiple components to it. So fecal contamination, for that, we look for data on E. coli or thermotolerant coliforms. We don't use other microbial indicators or proxies like total coliforms or hydrogen sulfide or residual chlorine. That'd be a fecal indicator bacteria. Very often these data come from administrative sources. Maybe the utility collects them, they report them to a regulator, the regulator puts out a report, we can use that. They can also come from household surveys. For the last 10 years or so, we've been working first with the multiple indicator cluster surveys, the mixed surveys, and then with other surveys to train field teams to measure E. coli in the field when conducting a national survey. We take these data at the place where people collect water, not the place where they actually drink the water, the stored water in the home. And that's to have comparability. In these surveys, you can actually get both. But if we look at administrative sources, I mean, they really stop monitoring water quality once it gets to the household level. So for comparability, that's the benchmark we use. But we have data from about 166 countries or territories on microbial quality. We have far fewer data on arsenic, only 73 countries, or fluoride, 76 countries. And often there will be a time series for E. coli, but 1 or 2 data points for arsenic or fluoride. And because they come from different data sources, different reports, different years, we can't converge them all at the household level and say how many people have water that's really free from fecal contamination and arsenic and fluoride. So we do this very simplistic approach. We converge at the level of the urban population or the rural population or the total national population, because that's the level that the data might be available at. And what we do is we just take the minimum of those 3 and assume that that's the limiting factor. And if we look at the countries that have at least 2 of these parameters and some contamination, in about 3/4 of them, E. coli is the limiting factor. And especially in low and middle income countries where we have data on E. coli, that tends to be a much more prevalent contamination than arsenic or fluoride. And that even holds for a place like Bangladesh, which has very high arsenic contamination. They also have very high fecal contamination. But there are some countries, especially in Europe, where fecal contamination is quite rare, where arsenic is the limiting factor. You can see kind of in Central Europe, Eastern Europe, the countries there, and maybe in Northern Europe, some countries where naturally occurring fluoride is the limiting factor that determines safely managed drinking water. So with that database, then we had enough data to produce estimates for 138 countries or territories for safety managed services. You can see from the map that the higher income countries tend to have more data on water quality and big gaps in Africa, also in Asia and Australia. Federal states are always difficult. But I want to show in this figure that you can have improved supplies, but they're very often not accessible on premises. That's the first one over there. They're often not, water is often not available when needed. And they can certainly often be contaminated. And this is just showing data points from sub-Saharan Africa, but the same holds for other parts of the world. So those 3 factors then, accessible on premises, available when needed, and free from contamination, any one of those might be the limiting factor. So we've looked on the left, you can see the number of countries where we have data on those things, either at the national or the rural or the urban level, and which of those is the lowest, because we do the same thing. We can't combine them at the household level, we integrate them at the urban or rural or sometimes the national level. And it turns out, you can see the number of countries on the left, but the proportion of countries on the right, in about half of cases, whether you're talking national, urban, or rural, microbial quality or quality is the lowest of these, and that determines safety management. But that's only about half of them. In about 1/3 of them, especially in rural areas, it's having that water supply located on premises that's lower. Coverage with water supply on premises is lower than coverage with water supplies that are free from contamination. And then the light blue, not so big in rural, but in urban areas, there's having water available when needed is more the limiting factor. We see this a lot. Well, I'll say why I think that might be the case in a coming slide. So I wanted to zoom in on some of those countries and to show in the circles freedom from contamination, and then the squares are on premises, triangles are available when needed, and then the bar is improved. I mean, one thing you can see is, especially in urban areas, you can have a lot of the population with improved water that is totally not meeting the free from contamination, safety managed requirements. So we've got 33 countries in rural, 40 countries in urban, and I wanted to zoom in on Lao People Democratic Republic, because in both settings, they have pretty high coverage of improved, on premises, available when needed, but they've got a ton of contamination. And this is fecal contamination, it's not arsenic or fluoride in this case. In the urban areas, the next limiting factor is availability when needed, but they're both really high, actually. Let's see, okay. Second which countries are limited by on-premises? Here we've got 27 rural countries and 22 urban countries or settings in those countries. Here, a very different picture. We see big challenges for water on premises in African countries, sub-Saharan African countries. And this curve really drops off. So in rural, but also in urban areas, a lot of countries in sub-Saharan Africa have water that's relatively free from contamination, but it's not located on premises. So this makes sense if you think about boreholes or protected water supplies that are communal water points and people have to bring water into the home. Then there are fewer countries that have a limiting factor of availability when needed. First of all, not all countries have data on this. So we'll make an estimate if we have data on contamination and accessible on premises, because we know that those are more commonly the limiting factors. But here, these are different countries. These are more middle income countries. A lot of Latin American countries, I highlighted Nicaragua, because especially in urban, they've got water, it's on premises, but it's not available when needed. We see this a lot where countries have intermittent water supplies and storage in the household, and they just don't have the quantities of water when they need it. Okay, so that's my last slide. I just wanted to say that quality is important. People think about the SEG indicator and they think it's only quality. Maybe it's the most important, but it's not the only thing. On premises is a big challenge, especially in rural areas, especially in sub-Saharan Africa. And availability is a challenge more in the middle income countries that have high coverage with piped water. Is just not really well managed, 24/7, always available when needed. So the limiting factors are different. The programmatic approaches to improving safely managed services will be different depending on those settings. So with that, I think I'm going to pass it over to Esther next. Yeah.
Thank you very much, Rick. So we're going to continue with filling data gaps. So Rick has told us a lot about all the data which we already have, and now we're going to focus a little bit about the data which we don't have. So zooming out a little bit, when it comes to the Sustainable Development Agenda, I think you're all familiar with it. We have 17 different Sustainable Development Goals. And for these goals, we have these targets. And so to monitor progress is really, it's crucial, but also a big challenge to have data on these targets. And so we have these indicators. And in this talk, I'm now going to focus on the indicator which Rick has already introduced to us, which is the 6.1. So it's access to safe and affordable drinking water. This is the target, and the indicator is safely managed drinking water. But and this is the the map which Rick has already told us about, which we have today. We have estimates for approximately half of the global population, which is amazing. At the same time, it means we don't have estimates for the other half at a national level. And just to get the big picture, so we're not the only ones struggling with this. There are many other targets, and as we see, there is not data available, and if, then it's also limited for the majority of these indicators. But what that also means is that we can learn from other people in this field, because we all have similar challenges. And so this is also where the topic which I'm going to focus on today comes into place. So here we're using data which is already available, so using Earth observation data, and leveraging developments in machine learning approaches, as well as the data which has already been collected to estimate progress towards these Sustainable Development Goals. And this is something which is being done in other fields as well. Until now, the majority of this work has been focused on environmental targets, where it's also more direct to use satellite images to measure different indicators. But in our case, we're focused on improving the quantitative data on progress towards SDG target 6.1. And for this, we're using variables which describe human activity, human population density. We're also using variables on climate, topography, hydrogeology, and biogeography, and we're using the survey results from the multiple indicator cluster surveys to train our models. These are just so that you get an idea of what kind of variables these are. So features from our human layers, they include population density, urban built-up land cover, blown area probability, ruminants distributions, as well as cultivated and managed vegetation. And I'm going to mention this straight away because I always get questions like, for example, why we're not including GDP and some other factors. So we started off with a larger feature set of 121 features, which we then reduced by using principal components and a cluster analysis. And so in this cluster analysis, urban built-up land cover clustered with global GDP and the global human modification and human development percentage and human footprint clustered with cultivated and managed vegetation. That's why they're not being used currently in the model. These are all the other features we're using. So now we're using 40 features, which described about 90% of the variability in the original 121 features we started off with. I'm not going to go into too much detail on these features, but as you can see, we have different information on hydrogeology. We also have biogeographic indicators, which are usually, as it says, geographic indicators. And then we have climate, we have indicators on temperature, precipitation, aridity, and topography, which also tells us something about geography. So whichever area is positioned is described by many of these features. So what we do is we use this Earth observation data together with the household surveys. And as people who are familiar with the mixed surveys, we don't have the exact locations for these surveys, at least for most of the countries. And so what we've done is we have calculated for each area where we have data, we've calculated the proportion of the population which have access to safely managed drinking water. And then we've used averages of these Earth observation layers and matched them at global administrative district level 1. And so we model safely managed drinking water as our outcome variable. This is one model, and then we've actually done the same for all the subcomponents of safely managed drinking water individually, mainly to better understand which features are driving which estimates, so to get more information about what we're actually modeling. So these are the countries which have been used to train the models. There are 27 different countries from low and middle income countries. You can see how they're distributed. These are countries where usually there were not estimates at a national level from authorities, which is why these surveys were then carried out. And so we can see that in general, we have very low, or at least for us who live in high income countries, we have very low coverage of safely managed drinking water. So the highest, and this is also important because it's our training data, so it's going to shape our models. So like the highest coverage rates are around 75%, which also means that we're limited to, we're going to predict within this range as well. We're using random forest regression. So this is a supervised machine learning model. It's today a fairly popular model. It's robust to outliers and also to features of different scales. And if you have questions on this, we can chat about it. I'm not going to go into too many details. Also, we use a cross-validation method. So basically, what we're doing to avoid or to be able to identify spatial autocorrelation is that we leave one country out with each round of modeling. So basically, for this we have 26 different models, and each time we're going to try and predict for a country which isn't seen in the data set and use this to validate our performance. And here we see some results from the cross-validation. So basically, these points, all of them have not been seen in the individual cross-validation models. So these are the 27 countries which were predicted from models which did not include their data. And as we see, we can pick up on trends. We see that estimates for low-income countries seem to be more accurate than for high-income countries, for upper middle-income countries. But all of these were modeled in our pool model. They were all modeled together. So this is just to see that we potentially do have some spatial autocorrelation when we compare to the pool model, which is basically we train the model on the data and then we predict for those countries. And so here, maybe we can remember, we have our first map, and here we fill data gaps for 67 low middle income countries. And what is also useful with these models, which we're demonstrating, is that we can predict at a lower resolution. So in this case, we're predicting at global administrative district level 1. And it's similar to what Rick has already spoken about. We see in sub-Saharan Africa, for example, that there is very low access in many regions, or in most, in sub-Saharan Africa, but also in most of low and middle income countries, we see low coverage of safely managed drinking water. So what we've also done is we've compared data which has been collected through national authorities, and we compared it here to our estimates. And so based on our training data, where we only use data from the multiple indicator cluster surveys, and we also only use observations with information about all of the subcomponents, we see that our estimates are quite a lot lower for upper middle income countries mainly, but generally systematically we're estimating lower. For low income countries, we seem to be quite accurate with our estimations. But it's interesting to see that we can actually predict these trends. And we have to see what we can pick up, how we can pick up on these nuances between countries to capture these differences. Also, as Rick mentioned, the methods for calculating safely managed drinking water are slightly different, so it's not directly comparable. So here, so there's a lot of maps which we've generated. Also, we didn't only model access to safely managed drinking water. We also did the same for E. coli, for access, and for availability. I'm not going to show these results now due to time, but this is just to show some of the things which we can do. We can kind of calculate them based on population. Affected. This is limited. The maximum number here is 10 million. But in India, for example, there are some districts with more than 100 million people where we estimate they don't have access in like highly populated regions. And another thing which is interesting is to see the importance of these human biogeographic, climatic, topographic, and hydrogeologic factors for estimating access to safely managed drinking water. Here we can see, so basically the color shows if the values which are contributing to a prediction, if they are low or high. So the most important features here, which were picked up, were urban built-up area. And we can see as an example, so higher urban built-up means it contributed to higher estimates of safely managed drinking water. If we see, so the opposite, for example, with another human layer is like the burnt area probability, where we see that lower burnt area probability contributed to higher estimates. And then we have these other indicators, so for example, the cloud forest prediction. The trend isn't as clear, but this is, we classified it as a topographic indicator. So here we can see that it's not super clear, but it seems that in some areas where there are, so these cloud forests, they are more likely to occur in like higher in regions with mountains in like tropical areas. So yeah, when you have lower values of this, then so lower cloud forests, it seems that they're both on both sides. So here we can't maybe define such a clear trend, but we see that they're a bit more on the contributing to higher estimates. So this is just to get an idea. This is also mainly hypothesis generating. So these are not causal relationships, but it's interesting to look at these trends. So some of them also confirm a lot of the analysis which has already been done by the JMP. But yeah, with population density, for example, we see a similar trend. And then we see a lot of these other sorts of geographic indicators which help describe the location. And to summarize this on a very high level, we can see that actually the human factors which we included, they contributed the most to our predictions. So limitations on the model and some of this. So basically our models are on the one hand only as good as the data we're feeding it, and or are limited at least by this. And so some of the limiting factors here are that the observations we're using, they are at regional levels. So we're limited with our resolution here. We also are only using data from multiple indicator cluster surveys. So potentially one could also use other surveys or not surveys, but other data sources to improve these models. And then we also have environmental variables and different surveys from different years. So when we're predicting, it's not completely clear which year, for example, we're predicting for. Yes, and so of course the model has similar limitations. But overall, it's been actually very amazing to see how far we can get with some of this data, which is available on a global scale. And I think, like my colleagues as well, but we see a lot of potential for improving these models and also for experimenting with different types of data sources. I think something which is interesting that we saw is how important the human factors are in these predictions, which is probably also not a surprise for lots of people. And yeah, there are definitely lots of ways of potentially improving these models and using other data sources and different features. Yeah, I want to briefly also thank our collaborators and project partners. So we're closely collaborating with the Crowd Lab, and I'd very much like to thank Thomas Glauber for also producing a lot of the maps we've seen here. And yeah, and also for the support from the Joint Monitoring Program, Aisha Donnes, who's also here, and Rick Johnston, especially, but also Rob Bain and Tom Staymaker, and also our external collaborators or Karen Levy, who's on the PhD committee. So yeah, and also thanks to Swiss National Science Foundation for the funding.
So we've got one more presentation, but before that, it's also on modeling. So we thought maybe while this one's fresh in your minds, we could open the floor for a few questions, or if you had anything about the first presentation. We'll have a discussion afterwards as well, but while fresh was Sarah Young from Northwestern University.
Hi, thank you. Sarah Young from Northwestern University. I really enjoyed your talk, and I was wondering if you had any experience talking with policymakers, like showing them these data. Everything is very interesting, but do they believe AIML stuff as much as survey data? Like, how does this resonate with policymakers? Thanks.
So the answer is I haven't directly spoken with anyone yet, but this is actually the first exposure of this kind of work. So we're also going to have a panel discussion where we're going to speak to experts in the field afterwards, And the main objective is also to hear their sincere and honest opinion, and also hear what kind of data they would need, because I think these models are fairly flexible. So if one can better identify what kind of data is really needed by national authorities or opinions, then one can also adapt or create other models to capture that.
Thanks. And I'll just add on that national authorities don't always believe survey data either. There's a big gap between the sectors and the statistics offices in many countries. Caroline?
Yeah, thanks, Esther. It was a great presentation. You chose to work with level 1 data. So that meant your sample for machine learning had about 300 data points. Can you explain why you chose that as opposed to working at the cluster level, for which you would have thousands of data points? Yeah. Curious to hear your reason.
So would have very much liked to have worked at cluster level, but we don't have that information. So we don't have like GPS coordinates or that information exactly. But that's something. So we're going to continue with a case study actually where we do have this data, and so that will be very interesting to see how far can you go when you have cluster coded coordinates. Yeah.
Great. I see a couple more hands. Maybe we'll take 2 more questions and then pass on. Please go ahead. And then you're next.
So I just a quick question about do you assume that the environmental factors don't change over time, or do you have a limit to the number, because you said the surveys are over a number of years, but to me it's red flag immediately. But is there a cutoff or an assumption of not really variability over years? Or is that something you found?
Yeah, that's a good question. So with the environmental data, there are several variables which we assume won't change. So I mean, there are also variables which probably will change a little bit, but I think the majority of them, let's say like topography or hydrogeology, or also the land cover variables, yeah, we don't assume they will change drastically, but they're also not really the limiting factor, because one could try and get data on those and those changes for some of those variables. So regarding the survey data, so that is a limitation to the data we have. Right now, the priority is to have estimates of areas where we don't have any data, using the only data which we have available for some of these other countries. But yeah, if it were possible to have data which is collected like with more intervals, then that would be great if one could work towards having data from a certain time span. I think these are from 2000, maybe between 2016, 17 and 2019.
Okay, so not so far, but just quick, how do you do data validation for those mistakes, for those sample predictions that you say you have no data on? So is it based on, like, I'm just thinking, like a synthetic control, like kind of those same variables taken, or how do you go about doing?
Yeah, so we've done various things. I think I might have some slides afterwards in the, if you wanted to, like, but we've checked kind of like we've looked, so one thing is like the cross-validation, but of course this is just focused on, you know, in general, we're just using data we have to validate. The other thing is what I showed you with comparing to other national estimates which have been reported by authorities, which are not included. So one of the, and then another thing we did was we looked like area of applicability and tried to define that based on the features we're using. So there, we also have maps where we show kind of areas which are outside of that area of applicability based on the features which are most important, and areas where these features, the values vary too much. And then we also, another thing we did was we bootstrapped our sample data and created like 100 models with like different subsamples, and then looked at variations of those and calculated like confidence intervals. So those are the maps we have, I've just not included them.
Thanks. And last question, please.
Yeah, I wanted to find out whether you calibrated this model against the real life condition, because sometimes it's very difficult to model with data that is coming from some of the countries because the data itself is not reliable. So how do you convince a policymaker if you are not able to calibrate it on the ground? So the question is, do you have plan to calibrate this on the ground, prove it the way it is, calibrate it and prove it and say, look, what I'm telling you is true. Let's go by what we can do with this data and then move forward. So do you have any plan about it?
So this is something I would certainly very much like to do. So I think that this is something we're also just starting to develop right now, but I think something which would be very interesting would be to use alternate or different collection methods which are more on the ground, maybe using like citizen science approaches or other approaches, and then to compare that. But this is something which we haven't started doing yet.
Thanks. I think both Esther and Joel are very clear that these models are not put forward as the truth. They're put forward as a prediction that might inform action to ground truth, like you said. Okay, and there are lots of other cool graphs that she hasn't included, mapping whether accessibility or availability or quality is the limiting factor. So there's a lot in the exercise to get that later. Next up, Joel Podorski, also from AFR.
Of course, here. Thank you. So yes, I'm going to be talking about also machine learning modeling, but giving a somewhat different perspective from what Esther just presented. And I, of course, have to acknowledge two colleagues with whom I work in this area, Lydia and Michael Berg, and SDC, so it's the Agency for Development and Cooperation, has funded a lot of this work. So we are creating models of geogenic contaminants in groundwater. That's the thing we're working on a lot, but using a lot of the same, these similar machine learning approaches. And just for a little bit of background, so we're looking at, just water that's being pumped out of the ground and used directly for drinking and cooking. With arsenic, this is something that's really should not be in our bodies at all. When you have chronic exposure to it, it can cause skin lesions, cardiopulmonary disorders, cancers, and the WHO sets the limit of 10 micrograms per liter for arsenic. Fluoride is a little bit different, I think quite interesting, because in low concentrations, it's good for our dental health, but in higher concentrations, it's bad for our teeth. And in really high concentrations can cause skeletal deformation. So that's, this is, what we're really looking at. So talking about filling data gaps, right? And this is a compilation of data of arsenic in groundwater that we did in 2020. Just of existing data, from published data, from national sources, what we could get our hands on. Of course, there are more data in existence, not necessarily available or easy to find. Anyway, this just kind of highlights that we have high concentrations of data in some places and little to no data in others. So that was arsenic, and then fluoride looks similar. This was the study we came out with this year. And so, yeah, North America, in this case, South Africa, India, Australia, parts of Europe have a lot of data, but in between, it's very scattered. And this is actually 400,000 data points. So the issue we're dealing with is how do we fill in these gaps, right? So, and also to kind of describe in very broad terms what we're doing with this, how this modeling works. So we're starting with concentration data. There we go. Of in this example of fluoride in East Africa, and the first step in this modeling of creating a prediction map is to identify predictor variables that are somehow related to this process of the release of an accumulation of fluoride in groundwater. And we take our known data, combine it with these predictor data using a machine learning algorithm. Once we found a good model that performs well enough, is accurate enough, we have confidence in it, we can apply the model to these predictor variables to produce a map. Now the caveat with this is that all of the predictor data themselves have to be maps, because otherwise it's not possible to produce one. And so that can make it a little bit tricky, and it's a little bit a little bit difficult to take only parameters that are available at the surface and predict something about something that's at depth, and groundwater quality at depth. However, it actually works pretty well, which was kind of, surprised us initially, but it does work. The point of creating the map is to get an idea of what the overall situation is, but then to help guide further testing efforts. It's not meant to be a final representation of where you find safe and unsafe groundwater, but rather where should we go test to make sure, because within close proximity you can have safe and unsafe wells. But assuming you can't test everywhere simultaneously, where should you go look first to ultimately make sure that people are not inadvertently, unknowingly drinking contaminated water. And so here's an example of one of our studies, India, the fluoride, and on the left, this is a typical government report, 2017, showing the proportion of high fluoride wells by state. So pretty low resolution, right? And then we were able to produce a pretty accurate model of high fluoride in groundwater at a 1 kilometer resolution. That's just a function of the predictor data that we were able to use that were available at 1 kilometer pixel size. And we did this for a binary variable. So we're predicting high or low fluoride concentrations. And that's, I guess, kind of maybe a luxury as opposed to what Esther's doing with modeling a continuous variable. It's a little bit easier to model a binary variable. And a reason for doing this is that it's easier to communicate the results, I think, because we're just worried about help. And there's a defined help guideline. If you disagreements if that's proper or not, but take the WHO guideline, in this case, 1.5 milligrams per liter. Are areas exceeding that or not? And so it just helps with the interpretation and the communication of the results. And on the right, we did an analysis with the population affected and showing the population density in areas with high fluoride concentrations. And then we've done this also for arsenic in South Asia. So Pakistan on the left, India on the right, using the WHO guideline of 10 micrograms per liter. And I'll give another example here of Ghana, which just did this year, fluoride in Ghana. And an interesting, something we did a bit differently here is an analysis of not just population, but children affected in northern Ghana. So we were looking at tabulating the numbers of children between 0 and 9 who are likely exposed or consuming high concentrations of fluoride in their drinking water, because they're more strongly affected by these fluoride concentrations during their physical development. And so there are obviously some problems in northern Ghana. This is our global model we came up with a couple of years ago of arsenic in groundwater. And again, it's a prediction of a high or low of arsenic. And so the redder the areas, the higher the probability of finding arsenic exceeding 10 micrograms per liter. Using those data I showed on one of the first slides with all the big gaps in there. And so some of the areas to highlight that the map shows as being potential hotspots or having a higher probability of high arsenic where we had little to no data would be in the Sahel region and also in Central Asia. A lot of the other ones we have data already, but even then, if you were to zoom in, there's still there. I think there's still benefit in creating a map for an area where you have a lot of data because the resolution of this is at 1 kilometer. And you see that better when you zoom in a little bit. So in Mexico, you can appreciate a little bit more of the detail that the model has, likewise for Europe or Southeast Asia. You can see the Mekong Delta, the Red River Delta, some of the other deltas in Southeast Asia that have a higher probability of arsenic in the groundwater. So, like I said before, the WHO guideline is accepted by many, but not all. So I think in New Jersey, they use 5 micrograms per liter as their guideline. So we created a map at the 5 microgram per liter level. And well, I'm sure there are others too. But anyway, it's interesting, right, to see what the differences are. And then also at 50 micrograms per liter, which is the old WHO guideline and still being used by some countries. So, you can do this sort of modeling for whatever the intended use of the map is. So it's of course it's flexible that way. Looking at the populations affected, this is highlighting all the areas where there's high arsenic, and then the density of the population there. You can see it a little bit better with Africa. We zoom in Europe, Asia. And then when analyzing all the affected areas, about 64% of all of the modeled high arsenic areas are in Asia, but it's a big continent. So, it's not too surprising, but far more than in the other areas. But then when we take into account the populations, 94% is what of the total global population potentially affected by these high arsenic concentrations, we calculate are in Asia. And a lot of this has to do really with two factors. One is obviously population density, but also the rate of use of groundwater. So we take that into account. So you might have other areas where they naturally have a lot of high arsenic, but they have treated water or is somehow managed, and so the population living in those areas don't come into this calculation. Now that for our recent fluoride model, again from some of the points I showed earlier with all the big gaps, this is the global model. Some of the areas again where there are potential hotspots indicated where we have little to no data. Africa again, it's generally quite data poor, and again Central Asia. So I guess quite similar in that regard. But it's also interesting, I think, that the model is identifying hotspots not only where we have data, but in places where we don't. But then this, of course, needs to be verified. This is not the final answer. This should be motivation to go out and test more in those areas. That's the intention of this kind of a map. And this is the population analysis. And here we find, again, Asia dominates, but with only 51%, not 94%, as with arsenic. Shared quite evenly in this case with fluoride with Africa at 46%, and then much less than the other continents. A little bit more analysis of those population numbers. In total, this is again for fluoride, calculate about 180 million people globally affected. And then on the right, this is just a comparison of the total number of people estimated to be exposed to high fluoride concentrations versus the total population of the country, not just those consuming groundwater, but the whole population. And on top comes Africa, around about 6%. And here I wanted to just say a little bit more about what we can get out of these models. It's not just the maps, which are nice and all, but we can look at more closely at the variables from the modeling process to better understand what is playing a role, why do these results come out as they do, as Esther was describing in her work. And here I just want to highlight these green bars on the left. This is showing the importance of the variables in descending order. And the importance means, in this case, the contribution to the accuracy of the model. And the top variables in this case, just using this example of fluoride, are climate variables. And then so these are all these environmental variables because we're dealing only with geogenic contaminant, this naturally occurring contamination. So in addition to the climate, there's topography, soil parameters, geology. The blue bars actually represent a different model that I ran that we could not create a map of because I included many physical chemical parameters that are measured in situ, like calcium and electrical conductivity and things like that. That's all these blue bars. But obviously we cannot create a map out of predictors that are available only in point locations. But it's still useful for understanding the processes at work here. And I think it's also interesting to point out that this level of importance from some of the spatially continuous surface parameters derived from Earth observations, they have a similar level of importance, comparable, a little bit lower, right? But to those that are measured in situ at the same depth, but with the same little bit of water, that it's just a kind of proof that these surface parameters are still quite good, and they should definitely not be discounted. One little bit of analysis that can be done with this as well is not only looking at the importance of the variables, but how do they affect the model itself. And so these plots on the right show the proportion of high fluoride concentration for different predictors. So on the left are some of these spatially continuous maps, the environmental parameters. So actual evapotranspiration aridity, subsoil pH, we see some pretty strong relationships. And then looking at these in situ parameters, for example, alkalinity, calcium, and electrical conductivity, see very, very strong relationships. And so with these, over 200,000 measurements within each one of these plots, with some averaging done, and I could explain that later, but I think it's quite remarkable to see these sorts of relationships. And so that's something else that this modeling can be useful for, is to understand these processes better. The last thing I want to leave you with, this is my last slide, is to mention our groundwater assessment platform. It's interactive web GIS platform for groundwater management. The URL of it is gapmaps.org, and it's a place where we have all of our maps, so you can look at it, but not just as a picture. It's GIS, so it's interactive. You can zoom in and put different layers on and out, and really look at it in detail. But you can also upload your own data to the site. You create an account on the site and you can upload your own data and even create a similar map. So we have kind of a simplified process on there where you could import your own data. We have some of the same predictor variables that we've used in these other studies on the site. You can bring it all into, you can create a model. I mean, it's up to you to decide if the model is good or not. So it's not, just one click and it's done. But once you've created a model, you can download that as a geotip and use it elsewhere. So it's a really nice tool without having to create the sort of map without having to do all the programming behind it. And finally, with it, you can also share your data publicly. That's also been quite useful for many organizations. So that's it. Thank you for that. And I don't know, we're going to do questions. Okay. So, all right, I'll pass the question to.
Yeah, thank you.
Yeah.
So thank you, Joel. If anyone has questions for Joel, they're welcome now.
Hi, I'm Katya Chiracamelli from UC Berkeley. Thanks for a great presentation, Joel. It's really nice to see all the updates, and I'm excited to check out your new paper. I had two quick questions. One about your fluoride population risk maps. What data are you inputting to look at actual groundwater usage specifically for drinking? And how does other aspects of fluoride exposure fit into that? Like if you're eating food that was irrigated with fluoride.
Yeah, so for that part, we're not taking into account at all with the food exposure. It's just drinking water. And we're using actually the survey results in the JMP reports of how much of what proportion of the population is using groundwater as opposed to tap water or some other like a packaged water or something.
And my second question is related to that point about the JMP data. Considering that a lot of the mixed household surveys that are looking at water quality questionnaires are not incorporating the geogenic chemicals, how can your models of fluoride and arsenic be incorporated into the safely managed drinking water estimates? Maybe this is a more broad question, but do you have ideas for how we can take that into account?
So I'm just producing these figures. How to best do that in my realm.
Yeah, we can think about that.
Yes, please.
Hi, Julie Sachs from Northwestern. Great talk, and I wanted to follow up on one thing you said, which was validation of the model. Like, given some of the sparseness of available data, can you estimate how many data points you would need to validate some of these model figures? How many data points? Well, I mean, so let's say taking the fluoride example model, for example, there's 400,000 data points. It's quite a bit. Anyway, so there was this validation that Esther mentioned, doing this, cross validation. So that's of the data that we actually have. But I also did, I did something where I took the model and then just analyzed compared the accuracy of the model for each continent. I mean, of course, you could make it a smaller scale, but we had data on all continents at least, not in every country, certainly, just to see if, okay, was the accuracy really good in North America and really poor in Africa, North America versus Africa. And it turns out it was actually all pretty good. I mean, it stayed at about the same level.
throughout all of the comments. So that was reassuring. But yeah, it's, as more data become available, then that can be incorporated into a new model, and then the model improves.
Or can your model drive data collection? You mentioned, like,
Yeah.
Africa specifically.
Yeah.
So like, do you need 400,000 more data points in Africa, or can you estimate I can give it 20,000 if I sample in these locations?
I see it as, if you're interested in providing safe water, or your own well, for example, if, determining if that's safe or not, then you just test that area or that well, and this is a guide to say, oh, we really need to make sure we do this here rather than there, or no, first in the areas with a high arsenic or fluoride hazard. But to really, I don't know. So if you look at the US and zoom in on the data there, there's a great density of data. I think it's probably unrealistic to be able to get that elsewhere. It would depend on what the ultimate goal is. But in order to say it, we've characterized the world to a high level of certainty. It's going to take a lot more data. I mean, but it will keep improving.
So if I could just jump in on
Yeah.
that, sorry, but are there cases where you've had a model prediction and actually gone to the field to test that prediction? And I'm thinking about your Sumatra paper. Or
Right, yeah,
some other
exactly,
cases.
yeah. This is an example of from an earlier study that didn't show arsenic in Southeast Asia, Sumatra and Myanmar, where there were no data from those areas where we predicted high arsenic concentrations, and then either someone from our institute or elsewhere went to those places, and because of the map, oh, we should check it out, and indeed found high arsenic concentration. So that's a great example of how to use this map or these predictions. Sorry, yes. Back.
You're doing the Ghana experience because I'm from Ghana.
Okay.
Yes, and I know. Oh my God, I really, there's a lot of chloride underground, and you dig boreholes, and you realize that the water can be used, so you want to move to another phase, and unfortunately, you have faced the same situation there. So it's valid.
Okay. Yeah. So thank you very much for all the questions. Now we're going to come to our second part, which is a panel discussion. So I welcome Katrina Charles and Caroline Leclerc to come up. And we have one panelist joining online, which is Mohammed Ba. Yes, that's it. This is not the same Mohammed Ba who just presented. Just to make sure that everyone looks. Yeah. Also, while we're just setting up, if you would like to participate, we would be interested in asking you 3 questions. So, which organization you are affiliated with? Oops. Which data gaps does your organization encounter today? And which approaches do you believe can help us fill data gaps on access to safely managed drinking water in low and middle income countries by 2030? I'm going to try this with Slido. So let's see if this works. So you can scan the QR code. Okay. So Mohammed, you're also welcome to switch on your camera if that's possible.
Yes, thank you. I'm hearing. I'm here.
Okay.
Great.
All right.
Do you want
Brief
to?
introduction.
Yes, exactly.
Okay, I'll just do a very brief introduction. So here we have Katrina Charles. She's Professor of Environmental Health and Risks at Oxford University, as well as Chair of the Oxford Water Network, and leads work on drinking water quality and climate resilience to support progress towards SDG 6.1. She's also collaborated with UNICEF and national governments, including work in Bangladesh, Ethiopia, India, Kenya, Malaysia, and Uganda. Then we also welcome Caroline Biglia, who's the Director of Research and Programs at Acquire, and also leads programs aimed at increasing access to safe drinking water and sanitation, and coordinates research teams in Ghana, Kenya, Uganda, who evaluate policies and interventions for water and sanitation. She also has a strong focus on data science. Then I'm also happy to welcome Mohammed Ba, who's with us. Unfortunately, not in person. There was a delay with and he missed his connection, unfortunately, so that's why he can't be here today. But Mohammed is a US State Fellow at the Institute for Sustainable Communities in Maryland. And he's also an entrepreneur from Sierra Leone and has worked as a consultant for Ministry of Water Resources, as similar to the other Mohammed Ba, and also for national and international NGOs. And in 2018, he founded an organization called Information for All Sierra Leone. So Rick is going to moderate our discussion, so I welcome him as well.
Thanks, and I just wanted to share apologies from Mohammed Ba, who is in person, because he was going to join the panel, but he's not feeling well, so he stepped down. But I wanted to start with Mohammed Ba from Sierra Leone. And I know that you've done a lot of work with, I'm looking at your picture. You've done a lot of work with the government of Sierra Leone, and I think you're very well familiar with the types of data that the government has access to, and also where the data gaps are in government, and how the government uses data on water services, whether it's drinking water quality or accessibility or availability. So I was hoping to hear from you, well, how big a problem is it for you, for the government partners you work with, where there are data gaps, and what your approach is when you don't have the data that you need. And maybe if you think models like the ones that we've been talking about today might play a role in filling those gaps at the country level. So, and if maybe you could describe a little bit your work as well when you start your response. Over to you.
Thank you very much, and good evening or good afternoon, everyone in the room. My name is Mohammed Ba from Sierra Leone, West Africa, as I was introduced. Basically, I have worked extensively in the Sierra Leone in the water sector and for the past 5 years. So basically, in terms of data is very important. And if everyone in the room may aware, and Africa is a very interesting continent. Basically, within 10 years, since 2000 to 2020, we've had population growth from 800 to 1.3 billion people. And this population is really increasing every day. And it's really very interesting for us to focus on providing clean and safe drinking water to these people. And data is key to ensure we have these people included in every aspect. And the government of Sierra Leone actually is really key into data. The only problem that the government is really facing is updating the data. The structure that are available to provide the data actually it's not been updated awfully. UNICEF and WHO and all, they are providing the structures, but getting the resources to update the data. For instance, in 2016, the government, together with the UNICEF, they developed a data portal where about close to 20,000 data was selected and updated in the portal. But since 2016, that portal has not been updated. they just left it blank and it is there now, not working. It's working, but data has not been updated. And we've jumped from the previous structures to new structures. And now we have other data sources that the government is using and also citizens are using, and organizations like us also is also using, like the water point data exchange. It's working right now. Everybody is talking about it. But what about the old portals that have been developed? So in this way, what we are seeing, every time we have new ways of collecting data, everybody will be talking about it. Everybody will be happy because there's a funding. But after 2-3 years, everybody will forget about it. We go to the new models. And if you continue doing this, we will not be able to succeed because it takes time for people to learn a ways of updating data, for people to learn the method and everything to collect data. So if people have used to collecting data in one way, and after 2-3 years, because there's no funding, we've developed another model, then everything again jumped to the new way, and they always have been abandoned. And these have been the challenges we are facing in Sierra Leone. Whenever we have a new ways of data collection, everybody moved into the new ways of data collection, and we abandoned the old data. And this will not help us. Let's have a centralized ways of collecting data. When we started, we should just be building on the existing structures. But getting a structure for 1 year, leaving it, going to the other, these have been the problem that we've been facing. So I think the best way we should be able to do this now is to have citizens generating their own data independently without making, okay, yes, government is important. Development partners also are important in data collection and management and synchronizing everything. But let's have a way to empower the citizens independently to collect the data. We have a single platform. We inform the citizens, okay, collect your data, your water data, provide us A, B, C, D, not to just rely on what development partners is doing independently or NGOs doing independently or government doing independent. Let's have a synchronized system in one place. We popularize it, everybody will be putting data in single platform. It is good. We have seen the water point data exchange. If everybody will be using this one to popularize, we encourage every NGO, whether local or international NGOs, to use this platform to update their data portal and also update what they are doing. It will be fine. But if we keep having silos of working, data will not be able to give us really what we are looking for. I think for in our own ways, we've been getting some mismatch of the data we are looking for. We are working in the water sector, and I have also my organization that I'm working with. We really need data, but basically we're not getting the right data we are looking for. Sometimes we need data for waterborne diseases related, but we don't see those data available. For example, if you want to go to a community, want to know if the people have been getting some illnesses related to water, but we don't see that in the existing data right now. They don't tell you, okay, number of people have died or number of people have been infected with diseases related to data, but we don't see that in the data. And sometimes also we don't see the literacy level of the community or the technical aspect of those who manage the data captured in the data that we are seeing. So getting these data, we have to go to the community, we find out and collect the data on our own using paper-based. I think there's a gap, but collectively working, I think we'll be able to get what we are looking for so far. I have more to say, but I think I have to leave it here for now. Thank you.
Now, these are really interesting points. Thank you so much, Mohammed. And I hope that we have time to have another round, because I also have some questions and reactions, especially about this point about citizen science and what types of information, what types of indicators could be collected. We've been having a discussion about these model data and data validation and data quality issues, and it'd be great to hear your thoughts on how those apply to citizen science as well. But citizen science, yeah. So, but before that, I want to turn to our other panelists who are with us today. And Katrina, I wanted to start with you and a question about like the types of data that are needed and the resolution of the data as well. So in the three presentations, we kind of saw a sequence where the JMP has like national and urban and rural, and that's about it. Esther presented some modeling at the admin 1 level with the hint that maybe it could be possible to get to the admin 2 or cluster, and then Joel's got like 1 kilometer grid, so you can do different things with those kinds of things. And you've done a lot of work with the REACH project that you co-lead, and I would like you to talk a little bit just about how big a problem you see this issue of data gaps, whether it's about quality or availability or accessibility, and what role you see for models like these to help fill those gaps.
Thanks very much. Is that on? I can't tell. No, I assume it needs to be for Mohammed to hear us. That's
Yeah.
better?
Bring it up to your mouth a little bit, Maria.
Okay. How's that?
Probably fine.
Mohammed, can you hear me?
Yes, yes.
Okay, that's the important one. So yeah, I think the presentations are really fascinating. It's great to get so much more depth on them because I think AI and machine learning have so much potential to change the way we understand the world. So I think, I mean, one of the other big uses of it recently in water was in Bangladesh's recent Enhancing Climate Resilience in a Changing Climate report. They've made synthetic households. So they've taken the household data and created synthetic households as a way to model risk in those areas. And I think there's lots of interesting ways we're doing that because there are these big gaps in data. And I think that was shown very nicely with Joel's presentation of just seeing these, these massive areas that we don't have, or that I should say Joel, within the limitations of what data is access to, hasn't managed to get data. And I think that's one of the big issues to highlight, and Mohammed's highlighted too to a certain extent, of looking at is it that isn't data, or is the actual problem how we manage data? How much of those areas are there data for that we don't have access to, and is there a risk through some of these approaches that perhaps we might create a perception that we have lots of data and we don't need to actually enter that data and do more work with that data. I would see that as a potential risk. I'm probably jumping off course a little bit with that, because I think that we use data for all sorts of issues in our research, and looking at one of the key areas would be like to inform sampling plans. If we saw this data, we'd be using it to inform sampling plans for drinking water quality, not to say we're not going to test if it's a low risk area, but that we can reduce our frequency. I think there's the much bigger risk that people go, it's not a priority, because it's already mentioned that there's a lot of pressure on governments in terms of the finances for water quality monitoring, and that's something we're both very aware of. And so yes, there would be that risk that that this kind of data could be misused in that way, or in a way that might be accepted. I think one of the best examples of that from that data is Ethiopia. So the Ethiopian one you showed had data that was available. There was only data on fluoride for the Rift Valley. That's quite likely because people have decided that's the only place that's relevant. So you've already got perceptions behind this as to why there's data there. Now, your map showed different risks in different areas, but this is where I think it's incredibly important to get a better understanding of that ground truthing of it, to look at that risk of where we're saying, to make sure we're not reinforcing that bias in the data, that it's not just being overly led by where we have data for, where people have already thought we have a risk for, and that it is a representative in areas where it's suggesting it's low risk as well.
Great. Yeah, I think this issue of, I mean, the great strength of the models, of course, is that they allow you to have some prediction for the areas where you don't have data.
Yeah.
By definition, that's what they're good for. And I think, we've heard the message clearly that these predictions are useful to guide actual real data collection to validate the predictions. And Joel shared some examples of where that's been done at ABOG. I'm going to turn next to Caroline, who works with Aquia and has also done quite a lot of work on water quality surveillance and what the barriers faced by governments are in collecting and sometimes using data on water quality in particular. But I wanted to kind of add to, well, I wanted to ask you two questions. I'm going to do it at the same time. I wanted to know your experiences of how governments manage when they don't have access to the data that they need, if you think models like these could help. And also, if you had any suggestions for other types of information that could either feed into these models or that could be combined with the model outputs to give some additional insights.
Thanks, Rick. And I apologize, I don't think this mic works, so I hope you can all hear me. Great. So thanks for your questions, Rick. I think decisions on water infrastructure or even sanitation infrastructure are usually taken at the local level. So it's usually districts or municipalities that are responsible for making investments or making decisions. But data on those specific units are usually unavailable. So we saw the GMP data is at the regional level. Usually Esther is modeling also at the regional or province level. But what often decision makers need is something at a more granular level. So what cities are particularly behind in a given country with respect to SDG 6.1? What districts are particularly behind and therefore need more intensive programming. And so it is often that data that I see missing at local level, either city or district. And that's where I am very interested, and I see the appeal of those modeling efforts that provide the granularity that is not otherwise available. I'm also aware of the risk of taking for granted what these models predict, because there are obviously error bars and uncertainties. And so how valid is it to say, I'm going to take this as ground truth that in this district, the arsenic model is correct or the SDG model is correct. And so I'm going to make decisions and say this district is behind that district. I think we're not quite there yet, but that's where the appeal is in machine learning, is providing the resolution that we don't yet have for decision makers. So that's important for programming. It's also important for research. I just want to highlight one example. Recently, we did a research study for USAID where we tried to identify successful cities in low-income countries that were really far ahead in terms of SDG 6.1. to kind of draw the lessons from their success and what are the ingredients of success. Well, finding these cities took us like 9 months and then doing the analysis 1 month. Like, so, so just to highlight, like finding information on who is successful was really difficult because there was no data available. So again, an example to highlight that localized data is usually missing. Rich asked me what other data sets could we overlay that with? So that's something we've started to play with at Aquia. So when you have maps, the appeal is that you can overlay it with another map. So there are similar efforts to map poverty at a very high resolution. Universities are doing that, private groups are doing that. So what if you could overlay access to safely managed water with poverty? Then you might be able to say, those are the regions in the country where I should really prioritize investments in pipe supplies, because those areas are not so poor, yet have very little access. So there is likely to have high willingness to pay, my investment's going to work. So that's one example how you might pair poverty and water access. You might also pair water access with different, with population density or rural typologies. So knowing that this area doesn't have water is one thing, but you have different types of rural areas. You have remote rural areas, small towns, close to the road, and governments may not do the same programs in those areas. But the moment you can have the maps and know, oh, I have this many people who are in those categories missing water, then you can orient your programming. So there is, again, a lot of appeal in overlaying data sets for decision making.
Absolutely. I think that is the power of these models when you can combine different types of information in that way. Mohammed, I want to circle back to you. You just heard Caroline speak very compellingly about how local decision makers need data that's available at the local level. I'd like to hear if that's your experience as well. And if it is, this question of where there are data gaps, how they can be filled. And you mentioned the issue of citizen science and people generating data on their own. We've heard about these models. In both cases, I'd like to hear your perspective on how ready planners in government, especially at the local government level, would be to draw on these types of data. Would they have concerns about data validity and accuracy, and especially maybe if you could talk a little bit about the citizen science and some of your experiences with the types of data that people can collect, and if that can be used to inform local planning.
Yes, thank you very much. And I think, as I mentioned earlier, data is very important, and Africa is moving. And even though we have so much data gap, if you look at the 2020 report from the JMP, you can see 21 countries had estimate for safely managed drinking water. And I think that has improved more, maybe close to 40 now for 2022. But going back to Sierra Leone, using the citizens, I think we've seen improvement in that and awareness from the citizens. And UNICEF is using a program called U-Report. I'm working with some local NGOs and international, and they are collecting data from the citizens in terms of various aspects, in various sectors like health, water, and all that, what is affecting the citizens to report independently. I think those examples have shown that citizens are ready. It's just that because everyone now is using, almost, not everyone, but almost everyone is using mobile phone, and smartphone, not everyone, but almost everyone is using mobile phone. So just using those citizens to collect the data about their water point in their yard or in their community, I think it will help, it will leverage the burden from the national government. Like my colleague Mohammed Badea, if you ask him, he will tell you they are suffering from funding, from getting from government to sponsor them, to collect data, to go through the community to collect data. Monitoring is a big challenge. So if we can just educate the citizens, telling them, okay, this is your water well, we want to protect you, just give us the data. Quality of the well, just tell us, is well working? Is this point working? Just give us report of your water point. I think it's easy for them to do that. So we don't have to start from scratch, and government are ready, I think, for that. Local government, sometimes the local government and the central government will have clashes in terms of politics, because if they are not seeing in the same eye, they will be thinking, okay, this is the local government, we are promoting them, or this is the central government, we are promoting their agenda. But devoid of that, citizens don't play politics too much. We have to put their mind off the politics and tell them, okay, this is your future, just give us accurate data, and they will be able to do that. And the awareness is there. It's just to ensure going down to the local communities and telling them, this is your future, just give us accurate data. We'll be able to make informed decisions for you to give you clean and safe drinking water, sanitation, and basic hygiene. I think citizens are ready to put this shot. It's just that we have to initiate, then things will happen. Thank you.
Okay, so it's things like access to water supplies, different types of water supplies that that voice from the ground level could be filtered up through these platforms like you mentioned. I think when it comes to things like drinking water quality or arsenic or fluoride, that's not the kind of thing you'll probably get from citizen science. So when you get to water quality issues, it's different, but maybe just the simple access numbers and the types of information that individuals without, arsenic test kits can provide could be enough for some decision making. Yeah. Okay.
Yes.
Go ahead. Sorry, Mohammed.
Oh, sorry. Yes, of course. So there are basic tools that we can use for water quality, for testing, equalize, all that. Just powering them and giving those tools to the local leaders, like the chiefs and anybody that in charge of the community as a community head, you can give them those tools to manage them, and they will be doing rounds maybe every weekend or every month or whatever duration that are given. They will be going to massively to the water point and do testing and report the information, and that will lessen the burden from the national and even to the local government. But if we said every data that we need for water point has to be collected from the national or the local government, it will take time and they will be asking for money. But citizens, for their own health, they will not be asked for money to report those data. But if we said we only want data from the national government or data from the local government, they will always ask, okay, give us the money. We have the money. We don't have enough resources. So how long will be waiting for resources? We only have 8 more years to go to 2030. So if we always keep waiting for the national government to provide the necessary data, I think we will not be able to achieve the target so far. I think the NGOs are doing their best, but let's collaborate with the NGOs and as well with the citizens themselves to collect the data. Let's give them the tools of testing water quality, availability, and all that. Let somebody within the community have those tools and they collect the data, and we give them a smartphone or whatever type of technology that we can give them to report it independently. So we have a portal where every data will be generated and we're able to collect the data. It will lessen the time. Thank you.
Thank you so much, Mohammed. Thank you for participating remotely too. I know it's not easy, but we really appreciate your interventions. With that, let's give a round of thanks to our panel. And Esther, is there anything you wanted to share from the Slido exercise before everyone heads out for coffee?
So I think you've already seen in the background, thank you for your active participation. Yes, so there are many different ideas here. We just see it like the word cloud, but I'll find a way of documenting these and maybe I can share the responses in another format on LinkedIn or on the internet. So yeah, thank you very much.
Really looking forward to that as well. Oh, yeah.